Hi guys, we're going to talk about theories and therapies for nursing practice. And my question to you is, why do we study theories? We study them because theories provide plausible explanations for why people behave the way they do. So in this chapter, we're going to talk about influential psychological theories with an overview of the treatments and their contributions. So let's get started here. So we're going to talk about psychoanalytic theory of personality, and this is Sigmund Freud. You probably all have heard of Sigmund Freud. He revolutionized thinking about mental health disorders. He believed that mental disorders resulted from unresolved issues that originated in childhood. So when he looked at his psychoanalytic theory, he developed what is known as the theory of personality, which states that human behavior is based on interactions composed of three parts of the personality: the id, the superego, and the ego. So components of these theory include the id. So when we define id, this helps determine an individual's personality and how they behave or interact in the world. This area is known for instant gratification. It can be physical needs or desires. It cannot tolerate frustration and seeks to discharge tension and return to a more comfortable level of energy. The id personality lacks the ability to problem solve and is illogical. So for example, an id personality is that screaming baby that is hungry, right? They're frustrated because they're hungry and their physical needs are not being met. And they're trying to return to a more comfortable level of energy. The superego is concerned with morals and following rules. Often people consider this their conscious. So all of the should nots that were internalized from our parents and society. This personality develops based on an individual's culture and what they are taught as right and wrong. It seeks perfection, and when it falls short, it may induce feelings of guilt. The ego helps determine an individual's personality and how they behave or interact in the world. This is often through a rationale of an individual's personality and can be viewed as both conscious and unconscious. The problem solver and reality tester. The ego attempts to navigate the outside world. So again, the ego has the conscious and unconscious. Conscious being the area of the psyche that is composed of self-awareness and feelings and thoughts, perceptions, and other aspects of mental functioning. And the unconscious is an area of the psyche that is composed of our desires, our impulses, memories, and emotional conflicts that are not directly accessible to awareness, but influences our behaviors and our thoughts. When we think about defense mechanisms, these are methods of attempting to protect ourselves and cope with basic drives of emotionally painful thoughts, feelings, or events. These defense mechanisms operate on the unconscious level. So deny, falsify, or distort reality really helps make it less threatening. So let's say your doctor just told you that you have cancer. You have 6 months to live. You refuse to talk to anyone about this, right? You could be in denial, and that's a defense mechanism that you may use. You use that to ward off any anxiety by preventing the conscious awareness of those threatening feelings. So I really want to touch on transference and countertransference on this slide because we're going to talk quite a bit about these as we move through this course. So transference is an unconscious feeling that a patient may put on the healthcare provider. Positive or negative, affectionate or hostile. They're transferring emotions that they originally felt in childhood. So you, in quotes, you remind me so much of my fill in the blank, right? This could help the nurse understand their relationship, their feelings, and their behaviors. So if they're very angry at the nurse, They may be transferring like, oh, you remind me of my mother, and I didn't like my mother, right? So those feelings get transferred onto the nurse. Now, countertransference is the opposite. So that's the unconscious feeling that a healthcare worker may have on a patient. Again, negative or positive. So it's really important to maintain that self-awareness so that the patient still receives the best care practices. So I think if you think about just in your own case, let's say you have a patient that reminds you a lot of the aunt, right? You loved your aunt. You're going to spend a lot of time with that patient, right? If you use this countertransference, because you're going to have this unconscious feeling, this positive feeling that's going towards this patient. The negative aspect of that is, though, how are your other patients being taken care of if you're overindulging on this one patient that reminds you so much of your aunt? So self-awareness with this is imperative. So the other psychoanalytic theorist was Hildegard Paplau, and she created a model that was based on the concept that nurses seek to understand their personal behaviors and the behaviors of those around them, and then apply the principles of human relations to one's needs. So interpersonal relationships we know are key to the nurse-patient relationship for mental health and for interventions that would benefit the client. We do see this in 4 phases: pre-interaction, orientation, working, and termination. So when we break those down, pre-interaction is preparation for that interaction: data, history, anticipating concerns, and that's when the nurse does a self-evaluation of feelings relating to working with this patient. And then we move into our orientation phase. This is where the nurse explains their role and the client expresses their needs. Goals are developed and a sense of belonging and a relationship is also developed. Then we move into working. This is where trust is established between the nurse and who they are working with. They're working together to achieve those identified goals. And then termination is that last phase. The goals have been met and the nurse has provided all the possible assistance. So I want you to think about your clinical day and consider these stages. And what does the nurse do in each of these stages, right? With pre-interaction, we're preparing to work with our patient. We're getting a report. With orientation, we're introducing ourselves. We're developing that rapport. We're getting to know our patient. When we're working with our patient, that's when our interventions are coming into play. We're doing those client-centered activities. And then termination is when we hand our patient over at the end of shift to the next nurse. Behaviorists didn't really agree with Freud and believed that personality and behaviors were synonymous. If the behavior changed, so did the personality. They also believe that behaviors can be influenced through conditioning, so reinforcing or diminishing a behavior based on a condition. So let's look at a couple of these behavior theorists. So John Watson came up with behavioralism. He observed behaviors, and the primary focus was on child development. So application includes if a child is not shown affection, love, or physical comfort, then the child may not display those features to others when they grow up. Pavlov, we've probably all heard of Pavlov and the classical conditioning theory, and this concept can be applied to the treatment of mental illness and can really inform the positive use of adaptive coping mechanisms. Conditioning with a bell and food, right? It's the same in humans. Think about the time that you ate something and you got sick. So every time you see that food or you're served that food in the future, where is your brain going to go, right? To that other time you ate it and you got sick. Skinner's operant conditioning theory is used to also treat mental illness, such as working with those with OCD or obsessive compulsive disorder. This is a method of learning that occurs through rewards and punishment for voluntary behavior. So behavioral responses are elicited through positive and negative reinforcements, which causes a behavior to occur more frequently. So think about the time maybe you were driving too fast and what happened? It caused you to get a speeding ticket. So as you mature, as you become better drivers, right, we become healthier, then we don't drive as fast and it decreases the chance of speeding. What about if you tell a joke in a room full of people and no one laughs? Ah, embarrassing, right? Are you more cautious about telling a joke again? You're not getting that reinforced positive feedback. And then implications for nursing. Let's think about the patient that is smoking. Maybe they're overeating or they're drinking alcohol. We may use a behavioral therapy to try and modify or replace those behaviors. So what are some of the behavior therapies that we can think about? The first one is modeling, which just provides a role model for the specific behavior and the patient learns to imitate it. Operant conditioning is behavior modification that uses positive reinforcement to increase desired behaviors. Exposure therapy is treatment for fears. So it is what it is, right? Exposure therapy. Let's say you are fearful of spiders. So if we're going to do exposure therapy, we're going to progressively expose you to that fear. It's going to create anxiety-provoking stimuli, and then we're going to teach you how to relax through that anxiety. So let's say we're afraid of spiders. So the first time I'm going to say, I want you to think about a spider. Ah, anxious, right? It's anxiety-provoking. But now I'm going to teach you relaxing techniques to get you through just thinking about that spider. And then we're going to progress from there. We're going to look at a picture of a spider, and we're going to relax through it. And then we're going to look at a real spider in a closed box, and we're going to relax through it. And then we're going to hold the box with the spider. We're going to let the spider crawl on the desk, and maybe we're going to let the spider crawl on your arm, right? Anxiety provoking, but you learned relaxing techniques to get you through it. That's exposure therapy. Aversion therapy is pairing a negative stimulus with a targeted behavior. So if you are nail biters or fingernail biters, did your mom or dad ever put that just foul tasting stuff on your fingers so that when you bit your fingernails, right, it was disgusting? It's an aversion therapy, pairing a negative stimulus with a behavior. Biofeedback is controlling the body's physiological response to stress and anxiety. Behaviors focused on increasing, decreasing, or eliminating measurable behaviors, but it didn't really focus on thoughts involved in the behaviors. So now we will move to the cognitive theorists. So cognitive theory contends that human behaviors are influenced by an individual's thought process. So we have two that we can talk about, and that is Ellis and Beck. So Ellis really aimed to eradicate irrational beliefs by helping people recognize the inaccurate thoughts. So let's think about A, B, and C here, right? A is our activating event. So let's say our event is a party. Your thought is, I hate going to parties, right? I have to hang out with people I don't like. I'd rather be watching TV. They probably just want a gift from me, right? Is that a belief, right? That's the belief. They just want something from me. I'm going to be miserable if I go. That's my emotional consequence, right? So what Ellis aimed to do was eradicate those beliefs, recognize that those thoughts are not accurate. So what we can do once we realize that those aren't really accurate thoughts, right? They're not out to just get a gift from me. Maybe if I reframe my thinking and think, man, I'm going to love going to parties. I love meeting new people. It's going to be fun to go shop for a gift, right? The belief is it's fun to shop. I'm going to have a great time. That's the emotional consequence, right? So recognizing those inaccurate thoughts and eradicating those irrational beliefs is what Ellis thought. If our thoughts are negative and self-deprecating because of our past, it's going to lead to anxiety and depression. So the focus is to change the way we are now because we can't change the past. Beck is the other one that we can talk about. Cognition is based on previous experiences. Therapy helps to reduce symptoms and change the way of thinking. So, test distorted beliefs and change the way of thinking to help reduce some of those symptoms. So, what can we do as nurses? What we can do is help the patient identify those negative thought patterns and try to create a worthwhile intervention, making sure we're still self-aware of our own thoughts of our psychiatric patients. Humanistic theorists thought behaviorists and psychoanalyst theorists were pessimistic and dehumanizing and wanted to focus on human potential and choose patterns that were supportive of personal growth. So the theorist that you have probably heard of, I hope you have heard of, is Maslow. And Maslow states that we can assert that psychology must go beyond experiences of hate, pain, misery, guilt, and conflict to include love, compassion, happiness, exhilaration, and well-being. Human beings are active participants in life, striving for self-actualization. And when our lower needs are met, the higher needs are able to emerge. So you have all probably seen Maslow's hierarchy of needs. The triangle, remembering we've got to have those lower triangle needs met before the higher ones can emerge. So the lower ones are our physiological needs: food, water, oxygen, elimination, rest, and sex, right? We have to meet those needs first before we can move up the triangle. When our physiological needs are met, then we can work on our safety needs: security, protection, stability, structure, order, and limits. But those safety needs have to be consistently met and predictably met in order to move up to love and belonging. Once those love and belonging, those are those healthy relationships. I feel safe physically, psychologically, and emotionally. When all of that comes into play, then I can go to esteem, right? I did it, right? Now I'm up to self-actualization where I can relax and have fun. But I can't meet or thrive in self-actualization if I don't have all of those things below it met. Nursing practice is twofold. So first, we have the emphasis on our human potential and the patient's strengths. So for example, the nurse may need to stabilize the vital signs and pain before collecting information, right? Meet the patient where they are at. Prioritizing nursing actions in the nurse-patient relationship. Piaget's developmental theory and tasks, and the next slide is going to have Erikson on it. Just be mindful that these are also theorists that work with our mental health. We're going to hit on these two significantly in our PEDS course, so I'm not going to really go over these in the mental health course. Here's Erikson. He just goes through developmental stages and tasks. You may have hit on a few of those, maybe in Gero class, some of those older ones: adulthood, old age, old age. We'll talk about infancy through adolescence in pediatric course. And that concludes the theories and therapists in your ATI book. If you have any questions, you can shoot me an email or we can chat about it in class. Thanks, guys.